Welcome back, if you're just tuning in, watching us, Annie and Zamil. And now, today, we're going to talk about a medical topic.
That's right.
And it is all about nasal polyp.
Yep, right before that, you saw the Hot Happening segment. That is Sophia, one of our newbies, is going to be joining us in March. Yes, welcome, Sophia. We're happy to have her. All right, now, this is a mouthful. I know why you did this to me. I know why you did this to me.
I know.
All right, let's welcome our doctor in the studios regarding a topic on nasal polyp, Dr. Saraswati Nachimuthu. She's the consultant, head of department of
Otorhino.
I'm sorry,
laryngology.
How do you say this?
Otorhinolaryngology.
Laryngology.
Okay, that is a mouthful
right?
for me. I'm very sorry. I can't seem to get that.
Otorhinolaryngology. Ha! I said it.
The Kuala Rahimah Hospital clang. That was a mouthful.
So, Dr. Saras, it's quite scary because you have something there just beside you, accompanying you. And tell us more about nasal polyps.
Yeah,
what is it all about?
Definition.
Okay, good morning.
Morning.
Nasal polyps are actually a sac-like growth which arising from the sinus mucosa.
Okay.
Actually, it's a prolapse from the sinus mucosa. It's not a disease. It's as a result of inflammation. The sinus mucosa, there'll be accumulation of fluid inside the sinus mucosa. Right. Over time, as gravity pulls these fluid-filled cells prolapses into the nasal cavity. And initially when it forms, it looks like a teardrops, like a membrane covers with fluids. Once it becomes mature, it looks like a bunch of grapes on a stem. It's like jelly-like structure.
Okay.
It's very soft in consistency.
All right.
It's semi-transparent, and it's non-cancerous. It's a benign lesion.
So people who have this constant congestion in the morning, is that something that they need to worry about? Would that be sort of like a symptom to nasal polyp?
Yes, yes.
That would be.
That is actually there are two types of nasal polyps.
Right.
Okay. One is nasal polyp that arrives from both sides of the nose.
Okay.
Another one, nasal polyp arrives one side of the nose.
Okay.
Okay. Before I explain about nasal polyp, I would like to explain what is sinuses.
Yes, please.
Actually, sinuses are hollow cavities that found in our skull.
Okay, hang on.
Okay.
Let me hold it for you.
And then
No,
maybe you can explain this.
Okay.
And if the camera can just zoom into what she's holding on to.
Okay, there are 4 pairs of sinuses that found in our skulls.
All right.
The biggest is the maxillary sinus. This
Okay.
is the maxillary sinus. It's found just below the eyeballs and just behind the cheekbones. These are the maxillary sinus.
Okay.
And these are the ethmoid sinuses, which are found in between these both eyes.
Ah, okay.
And then the frontal sinus found on the forehead.
Right.
These are the frontal sinuses.
Right.
And these are the sphenoid sinus found located in the center of the skull. Okay. These sinuses are lined by a layer of epithelium. Okay. This epithelium produces mucus.
Okay.
Okay. This epithelium contains with cilia. Okay. This cilia clears these mucuses into the nasal cavity and it goes into the back of the throat.
Okay.
What happened once these sinuses are open into the nasal cavity through a sinus opening which is called sinus ostium. Okay, once there's an inflammation or infection, these openings get closed.
Okay.
So there will be accumulation of mucus inside this sinus mucosa.
Right near the cheekbone area.
Yes, yes.
And that's why people say it's very uncomfortable, very.
Okay, because this
difficult
mucus
to manage.
cannot drain out from the sinuses.
Right.
There will be accumulation of mucus.
Okay.
This is a potential space for the bacteria to grow. This condition is called acute sinusitis. Okay, if this acute sinusitis prolonged for more than 3 months, this will cause chronic inflammation of the sinuses. Okay, this is a triggering factor for the nasal polyps to grow.
Okay.
So,
How common is it in Malaysia? Since we are in this country where we have humidity and we don't have pollen, but we have a lot of other allergies, right?
okay, it's seen 1 in 100 people actually. It's
1 in 100.
1 in 100 is more common in men than women. 4 times more common in men than women.
Men than women. Okay. So we women are a little bit better. Now let's talk about the symptoms for our viewers out there. Can you just give us like a quick rundown of the symptoms?
Yeah. Runny nose.
What happens? Because I know for a fact, and I think the viewers might just be agreeing to this one, that a lot of them wake up in the morning, massive congestion, a little bit of a pain around the your temple area, your nasal
well.
passage, and of course here, as you mentioned earlier. So could you just maybe give us a quick rundown?
Okay, these polyps are actually graded. They are all together 4 gradings. Grade 1 is the polyps reach up to the level of the sinus ostium. Grade 1, this polyp reach upper part of the node. Grade 2, it's middle part of the nose. Grade 3, complete obstruction. If they present with the grade 3 and grade 4, they complain with the nasal obstructions. Okay, the main symptoms is nasal obstruction.
Right.
They feel like their nose is blocked, and they breathe through the mouth. And then at night they snore as well, and then sometimes they present with the choking like sensation. It's called obstructive sleep apnea. It's temporary cessations of breathing.
Right.
So is it because the mucus?
Yeah, because the nose is obstructed with the polyps.
Right.
Okay.
Oh, okay. It's not because of the mucus like going down to the throat.
If the mucus get infected, they will have foul smelly discharge from the nose, and they will have postnasal drape.
Right.
All right. Now, the picture that we saw earlier, right before this one, what exactly was that? Is that this one?
No, this is just a normal nasal cavity.
It's just a normal nasal cavity.
Okay. No information there?
No, it's just one.
This is pretty much how it looks like.
Okay.
All right. Now let's talk about people who may have the same kind of symptoms that you've just mentioned. What can they do? What kind of medication? I mean, is there like a home remedy they can take, or is this something that they should actually go and see a proper, doctor?
But sorry, I think before that, what are the actual causes of this nasal polyp?
The exact cause is not known yet. It's not fully understood.
Right.
Right. So it might be food, might be dust. It can be anything.
Main thing is infection, chronic inflammation of the sinus mucosa. Second is allergy. Okay. Some allergic rhinitis is a manifestation of allergic disease. Okay. It's found 10 into 25% of population. Okay. Those who have these allergic rhinitis symptoms, they are sensitive to certain type of allergens, which is called house dust mite or grass pollens or dog or cat fur. Okay. Whenever they exposed to these allergens, whenever they inhale this allergen, it goes into the sinus mucosa, and the body immunity system react against these allergens, and it's produce a type of chemical which is called histamine. This histamine is responsible for symptoms like sneezing, running nose, itchiness of the nose, eyes, and postnasal drape.
You might just need to treat him after this.
I keep thinking, why am I part of this statistic? Okay. So what are the usual sets of treatments that are being offered or provided right now?
Before the treatment, we should investigate first. We should do the nasal endoscope, thorough check. Nasal endoscope is the instrument which pass into the nose to see the sinus opening and the nasal cavity, and then we'll do a CT scan to see how is the sinuses, whether there's a polyps, is full of pus or anything inside the sinuses.
Can there be also bone erosion because of this?
If fungal sinusitis can present with the bone erosions.
Now, doctors, some people say that when you have, as you mentioned, third and fourth degree of sinusitis, that getting a what do you call it, a surgery is good, right? But some people have also said, and again, this is through people who I've met, who said that once, even after doing their surgery, they still have recurrence of blocked nose. I mean, occasionally, or rather, it comes on every morning and then it just goes off. Is this something that's quite normal? I mean, I thought surgery actually completely takes it away, is that possible?
Surgery is not treatment for nasal polyp.
Totally not a
it's
treatment.
Just symptomatic relief only, because once the triggering factor is still there, the polyp is going to grow like allergens. So must find out what they are allergic to and must avoid that. So, and must treat the infections. So if triggering factors still there, then the polyps is going to grow again.
Okay. Now we're seeing a very scary picture on this.
I think it's a 81-year-old Chinese lady, right?
Yes.
And this is a nasal obstruction she's had for 30 years.
Wow. Yeah. This is really chronic.
Yes.
This surgery?
We did a surgery for her.
Okay. All right.
This is grade 4 polyps.
Okay.
So can it ever be curable, nasal polyps? Or will it still relapse after a certain time?
Only some people it relapse. We can cure the surgery.
Okay. All right, doctor. Now let's talk about surgery. As you mentioned, is only just temporary relief. What can people do if you do have sinus? You've gone through surgery and it's still coming back. As you mentioned, it'll be there all the time. Are there any kind of alternative medicine that people can look into?
Normally after surgery they must do regular douching of the nose.
Okay.
So to prevent from relapsing to these polyps, they must regularly douche their nose and must take this nasal sprays.
Right.
Nasal sprays contained with steroids. So this prevent from the nasal polyps to grow back.
Okay, now popping steroids always is not good. Again, is that going to be giving other kind of effects on the body?
It's just topical steroids. It's not like tablets form, you know.
Right.
It's topical. Is systemic absorption is very less. It's 0.01%.
So it's not.
So if those who are taking long-term steroids like more than 3 months, then only it causes complications.
Right.
Otherwise, topical steroids is very less.
I've been told that this type of condition, you know, if you have sinusitis and all that, it's like you have to take it's not even a course of medicine where it's a set duration. Sometimes it's for life because you have to keep spraying and all that, right?
So you have to, wow, that's interesting. All right, now Malaysia, we're just going to open the phone lines again to you. 22829062, 22823043. Give us a call if you have a question for the doctor, or if you are going through something similar, give us a call, share your story with us. We'd love to hear from you.
Okay. Doctor, maybe you can also explain, you know, sinusitis is something that, or allergies is something that we can avoid, but how can we prevent from getting nasal polyps?
Okay, you must find out what is the triggering factors that causing this nasal polyps. One of these is allergy. So those who are allergic to, don't know what they're allergic to, they must do this allergy test, which is called skin prick test.
Right.
So they must find out what they're allergic to, and they must avoid this. If 20 to 40% of patients with nasal polyps also present with bronchial asthma. So they must control with their asthma, must take regular medication to control their asthma attack.
Right.
Okay, and then smoking, must avoid smoking. Smoking is one of the triggering factors as well.
You have a patient here, by the way.
With asthma, okay.
Yes, so now we're seeing a couple of pictures on the screen again. Now earlier on, I think that looked like what you mentioned, you know, a bunch of grapes sitting there. That was one of the pictures that you were mentioning as well.
This
one
is the one.
Yeah,
this is the one.
This is basically the polyps at the back, on the side, yeah?
Yes.
Wow.
So do you actually remove it, or does it shrink after you spray it on?
Usually we optimize patient with the steroid, with the medical treatment. If in spite of the medical treatment, still the complaints of like symptoms like congestion, muscle blockage, then we will do the surgery for them.
Okay, doctor, we have a caller on the line. Mr. Bala is on the line right now, possibly with a question. Hello, good morning, Mr. Bala.
Hello?
Good morning.
Hi, good morning.
Do you have a question for the doctor?
I'm watching TV now.
Yes.
Sorry. I'm watching TV.
Yes, go ahead.
My problem is I'm always spray, spray, Tremolo and all this. So sometimes I can get this sinus because of spray, the raccoon, you know.
Okay. He meant pesticides, yeah.
Right.
I want to control the problem.
Okay. The is it pesticides for when you do gardening? I suppose so. Okay. Chemical. Okay. Chemical.
All right. Thanks, Mr. Bala. Thank you very much.
Yeah. Some people might get
exposed
triggered
to
because
the
of
chemical,
even with the spritz of perfume.
Yeah.
So perfume.
So what can Mr. Bala do? I mean, if that's the case, I mean, besides the fact that he should just reduce inhaling all this chemical, is there something else that he can
He should wear mask to prevent the exposed to this chemical.
All right.
Only that, other than that, because he's sensitive to this chemical, that's why it's causing all these allergic-like symptoms.
Okay. All right. Now, doctor, very quickly, for those of them who are watching us this morning, where can they go to if they want to get more information, and can they come to you to have a look at full scan? How does that go? Is it like a yearly thing that they should do? Come and get a checkup done? How does that work?
If they have symptoms,
symptoms
of
nasal congestion,
blocking sensation, postnasal drip, sneezing,
any one of those that they're doing
right
now.
All right.
Okay.
Right. So thank you very much, Dr. Saraswati. She is the consultant from the head of the Department of Otorhinolaryngology. from Tunku Apon Rahimah Hospital in Klang. And it's a pleasure to meet you and shed some light on this.
Thank you so much for your time this morning.
Thank you.
All right, so there you go. If you do go through or you are going through any of the symptoms that the doctor mentioned, congestion in your cheek area, pain, temple pain, you might want to get it checked. If you wake up every morning with a congested nose and you're not too sure why you keep sneezing and you want to sneeze and you want to get it out, this might just be the problem. There could be a little polyp that's growing. There could be just, major sinusitis working.
Just get it checked.